Hi, thank you. Thanks for the intro. That pretty much covers my first slide. I'm really excited to be here. I'm also now I'm doing psychedelic integration coaching. I feel like there's a big need for people to have the ability to have access to meaning making in this process, and so that's been the next leg of my journey. And as I'm excited to address nurses specifically who are interested in this, because we're encountering people who are interested in using these medicines or using them, and we're seeing them in wherever we work. We're seeing people that mental health affects their lives, and um, and they're holding multiple realities in their bodies, and we are unique in our that we're not looking at people necessarily as just symptoms. We're trying to look at entire people, and that includes mental health, no matter if you work psych or not, if you work postpartum or oncology or wherever. We're seeing we're going to start seeing these interventions percolate into our work and our lives. Um, so I wanted to talk to you guys today about psychedelic harm reduction and also integration. And it's like, what do these two things have in common? These seem like different topics, but I think the bridge between them is that we're undergoing in our culture a psychedelic renaissance. There's a lot of buzz around psychedelic therapy and studies, and but it's not quite, we're not quite there yet, right? And there's also a lot of people that I encounter, that I'm sure y'all encounter, that are really desperate for healing. And so we've got this kind of gap between everyone's really excited about psychedelic therapy, and then there's a lot of people that really need healing. And then there's this place where, like, okay, where do I go with this? People really are wanting this healing, but it's not really available. There's not regulation. There's not a whole lot of access. I encounter people a lot. It's like, where do I get some mushrooms? I heard it heals depression. Well, it's not that simple at all, you know? And so what are people going to do while in this like gap when we're trying to work things out, right? They're going to DIY it. They're going to try to figure it out. They're going to be like, let me get some mushrooms, let me take them, and then I'm going to heal my depression. And you know, I in that I kind of want to talk about harm reduction in general and where we are as a medical field with substance use, and also about psychedelics and the possibilities of that, and what we can kind of look at um, as healthcare professionals about what to be aware of as this renaissance continues to unfold. Um, so maybe like a little bit of a different perspective. Because if we want to be cutting edge in this movement, we have to be like really open and understand that we don't really know what's going to happen. If you all have taken psychedelics and you know about psychedelics from a personal frame, it's often they ask a lot more questions before they give answers. So culturally, when we're introducing psychedelics into our culture, we're going to be we have to really look at our culture, and we know as healthcare professionals how much there is that's actually wrong. You know, we're going to have to get a really clear look about it. So let's go to the next slide. We'll see. Um, yeah. So I want to talk a little bit about harm reduction first in general, right? The harm reduction movement is a substance use movement. Primarily, it's about, I put it here, it's a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. This is usually harm reduction focuses a lot on opioid use and other types of drug use, right? But I think it's important because I don't know what it's where other people work, but a lot of my experience in clinical mental health, there's a lot of stigma around drug use in general. And that's not just illicit substance abuse, that's anything that's culturally sanctioned drug use. That's people saying that people that use opiates are drug seeking because they have a high tolerance because they've had chronic pain forever. So there are 30 milligrams of Oxycontin that they take every day. When they're like, take a 10 milligram, you know, something a lot lower of a dose, take a tramadol, right? It doesn't cut them. It doesn't even start to address their symptoms, and then they're a drug seeker, and then they get the bad rap on the floor. And it's just, you know, we're creating problems, and then we're not solving them, and we're blaming the patients. And that's even more so with illicit substances. And you know, the harm reduction approach looks at substance abuse and substance use as there's also a social justice component. And it's like a built-in respect for the rights of people who use substances. It's not looking at the symptom of people that use substances, right? So I really, I'm also gonna say that harm reduction asks us to go dig a little deeper into why people use substances at all. And also the mechanisms that drive substance use and compulsion. So we can go to the next slide. And I want to look at trauma here. I have a PTSD background, and also I really see it a lot clinically that, and we really know most people that I've treated with addictions have a trauma background. So they're really trauma is a revolution in mental health right now. It wasn't really talked about 20 years ago that much. It's pretty like a pretty new, another exploding field in mental health that's paralleling psychedelics. And I think that's really, really cool and timely and perfect. And when we're talking about harm reduction, I think we want to look at trauma because as we're looking at the entire individual, we want to be looking at why people are using substances. Well, it's probably because they are having really intense feelings that they don't know how to cope with. And, you know, and when their tension and discomfort reaches a critical mass, something needs to give. They need to like tamp it down. Something needs to change. And we're not taught coping mechanisms in school. Like a lot of people with childhood trauma are not taught that by their parents. You know, and when we're looking at a person that's using substances, we really want to be like, what happened? Like, why are you choosing to do this? It's really, it's making your life more difficult, and yet you can't really live without it. It's like, I need my heroin, I need my benzos, I need my, you know, my thing that helps me survive in life. And you know, there's some this is quite big, and in trauma the sympathetic nervous system is hijacked all the time, or just at seemingly random times when people are triggered, and that takes someone directly out of the present moment into a chaos state. And you know, polyvagal theory shows us that a lot of people that have experienced trauma and have complex PTSD or just emotional dysregulation they don't know how to relax. Their parasympathetic nervous system is damaged, and so sometimes they just need to go offline, and their bodies doesn't know how to do that on its own, and so they'll take a substance. How can we really blame them for that? We can go to the next slide. So a little more about trauma. So understanding what a common experience this is, I really start looking at people that use substances in general, or compulsing soothing mechanisms, as self-medicators instead of addicted people. Because there's reasons. We gotta like be like, there's a reason why. It's not just because they have bad willpower, or they're like hurting people, or they're just lazy and can't. There's a reason why people are doing this. They don't know what else to do. They don't have the skills to do something different yet. So harm reduction asks us to meet people where they're at, and remember that people are doing the best they can, and just encourage that this is a process, um, and that there's limited options to really complex problems, that our cultural ideas and systems, especially in mental health in the US, are just hugely unprepared to address. Um, and drugs and alcohol are really available, and people that have trauma kind of gather around those subcultures, and and they they find camaraderie in that, and they get together to not feel so bad oftentimes. Um, and that's really, we got to remember that there's some really, I was doing some research, and there was a needle exchange, harm reduction. In the movement of harm reduction, they do legal needle exchanges and allow people to use IV drugs in a safe setting. And there was a needle exchange program. They did a study, and 96% of the people who went to that needle exchange had experienced a traumatic event in their lives, and an average of 3 traumatic experiences before the age of 16. So those, and we're talking like big traumas, like sexual assault, being tortured, being seriously attacked, and life-threatening assaults. Like, it's not just, they're not, there's a reason why people are doing this. And I really want to underline that, and have people understand that when they're looking at people that are, even when people are acting like acting needy or acting out on their traumas, and that they're from a place of deep woundedness. So I just want to really point that out to nurses, because we encounter these people all the time, no matter where we work. You don't have to be working in detox or in mental health to see evidence of this. And I think we could do a lot to help, just by having compassionate eyes on people. So we could go to the next slide.
Yeah, I have a question, Zoe, too. I'm
Yeah,
wondering
sure.
your thoughts. Do you think that this is kind of where that social justice aspect is related to when we think of like harm reduction, and then like these very complex systems of access to certain things, right? Like, whether it's alcohol, whether it's, whatever, right? I mean, I feel like this is kind of like where it maybe comes together.
Yeah, I think that's a really good point. I absolutely do think that that's this, because there's so much more laced in there. Okay, mental health is only as good as the amount you could pay for. One thing. Other thing is that marginalized populations have highly increased levels of traumatic experience, and so much less access to any kind of help. And in a capitalist for-profit medical system, you really, there's not a whole lot. Like, okay, therapy is great. It's $125 an hour. Like, it's not on people's radar. People are there, it's not accessible. And there's harm reduction and social justice are definitely linked. They can't be unlinked, I think. We're also looking at people, we're looking at the whole person again. I mean, the rate of even in Sydney, I think 36% of the people who are at that needle exchange were Indigenous. It's just now people are looking into studies of ancestral trauma, right? And what carries over from marginalized people over time, and the inherited uh, chaos. And then again, why are people doing what they're doing? Like, well, it's not that simple. It's not just because they woke up and felt like it one day. It's really because they don't see another way. They weren't taught another way either.
Yeah, one of the things that I notice is this constant like blaming as well, like on the individual, where everything is like it's your problem, it's your trauma, like you need to deal with it, rather than again addressing those like systemic issues that are actually responsible for what is happening in these in the lives of many of these communities, right? The trauma and all of that. And we see that a lot like as nurses, with our patients. Even if we're not, like you're saying, even if you're not in psych, like we see it in our Oakland community like every day, so for sure, definitely think that like just really good to remember like that connection. So thank you for
Yeah,
that.
yeah. I mean, even with, it's like even children are often the brunt of it. I worked in adolescent inpatient care, and so many people would come in with oppositional defiant disorder, and they'd be hospitalized because their grandmother pulled a knife on them, you know, and they're the identified patient. It's just like the entire family unit is dysfunctional because the entire family unit of the previous generation was dysfunctional because they have been marginalized, and there's just these big nets, and everybody's trying to cope with it in a way that and then they get blamed for it, and they got 70% of the people in that needle exchange study had been incarcerated. 62% didn't have stable housing. It's just like these compound problems, and we're splintering people into these little subsets of like, oh, you're an opiate addict, so I know all about you. Like, that's really not helpful. It's really, and unfortunately, it's the status quo of our medical system. So, what can we do as nurses? I know a lot of us feel really disempowered often because we feel like drug pushers. We feel like we just have to do what we're told. We don't have time to listen to people's stories. We don't really have. We try really hard, and sometimes we do have patients that are attention seeking, that are needy, that a lot of people that have PTSD and trauma and attachment disorders act out in ways they have access to, like qualities they're difficult to deal with when we don't have time, and that's real for us. And just to remember that, like, again, through the heart eyes, through the compassionate lens of like that added axiom, like, not what's wrong with you, but what happened to you, like what the kind of the what's at the root of this. So yeah, yeah, this is important. Until we have adequate and accessible systems in place to address unresolved trauma, generational trauma, family systems, nervous system overwhelm, and maybe like high school, in teaching coping skills in high school, and just until we have a radically different system, we can't really be blaming people for doing what they're doing at all, because it's hard out there, you
If I
know?
can just share too,
And
Zoe, I'm
sure.
encouraged, and I understand, obviously, I come from a, privileged neighborhood, but a start is a start in that they're starting to teach basic mental health practices at even the elementary school level. There's a group called Soul Shop, or Soul Workshop, that goes to different schools and teaches kids how to be empathetic, how to basically deal with their emotions and other people's emotions in appropriate ways. And they use age appropriate analogies, like somebody's bucket being full or their balloon being full. And we take in all these feelings and our balloon fills up, and then sometimes it pops, and it might pop on somebody who, didn't necessarily contribute to the filling of the balloon. They were just there. And so I think a start, it's encouraging to see a start. It's, you know, too little, too late sometimes for a lot of people, but yeah, it's starting to happen, thank God.
Yeah, that's really encouraging to hear. I hope we get to see more and more of that, and it can get deeper and deeper where people are able to, you know, be like, when your parents' buckets are full, it's not that they don't love you, it's just they're overwhelmed too, you know, because so, you know, kids go to school and then they go home and their life is radically different too sometimes. It's and you know, it's just really complex, but that's very encouraging. I'm so they definitely didn't have that when I was in school. Um, so yeah, and at this point, we just you know, with the adults especially, we just have to meet people where they're at. I am also really hopeful about the next generation, and we're, you know, where a lot of the people that we're dealing with now, a lot of our patients that aren't young people, they're hacking out the old ways, and yeah, and I again on the harm reduction and the social justice part of this, you know, the crime and punishment model of treating trauma, which it largely is. How many I don't have a stat on it, but I know that over 50% of people that are incarcerated are victims of trauma, a lot of them childhood trauma. So that model of treating trauma is just cruel and archaic, and we need a radical update on that. So many systems are, we really need, we need radical updates on basically our entire system of, and I think trauma is a great place to start. With that, understanding trauma and treating trauma, I think would do a lot for that. So we can go to the next one. I'm trying to go pretty fast because there's a lot to cover. So what does this have to do with psychedelics, right? Talking about trauma and harm reduction. So trauma, psychedelics does offer the promise of actual treatment for trauma, depression, anxiety, and better relationships with yourself primarily and with others, and an ability to see the entire picture and how to change like mechanisms of changing yourself. So many of my clients in the psychedelic integration work that I'm doing, they see they're like, you know, it starts with me, and then it affects the world outside of me, and these medicines have so much ability to show that when it's guided, you know, when they have someone to talk to about it, and when they're guided to set intentions and really look at what they want to focus on, when it's like used as a tool, right? And it's held in a space that's loving and comforting. It can be transformative, and that's why people are so excited about it, because we know that the status quo doesn't work. We know that medicating people is not always a healing tool. It's often symptom management, which has a lot of complications. So it's really exciting, and I think it does offer the promise of treatment for trauma. Like, wouldn't it be great to see like criminal justice system start to be a trauma treatment system, and using psychedelics and social workers and psychedelic guides in that. I mean, that's a dream. And it makes me want to cry a little bit, because that would be so beautiful and so helpful for our culture. And we're far away from that, unfortunately, especially like in the South, right? In Louisiana, if all the prison systems are still for profit. There's just, I don't, we're really excited about psychedelics, and the psychedelic renaissance is also where we're at with that. Like I was just speaking about in the beginning, the gap between psychedelic potential and where we're actually at, it's really likely to cause some fallout, that our current health system is really not prepared for, as it stands right now. And psychedelics is often about rapid transformation. It's pretty quick, things happen fast. And so when we're introducing psychedelics to our current medical system, I'm like, how fast the medical system is going to have to catch up pretty quick. And because of the way that psychedelics kind of addresses all these things, it addresses social justice, it addresses mental health, it addresses trauma, it addresses, it doesn't pick one thing. It's a pretty multidimensional, it takes a multidimensional look at things. As nurses, as frontline, and doctors and as frontline practitioners, I think we have to be really ready for like what might come out of this. So I want to talk a little bit about that. I obviously am a proponent of psychedelic treatment. I've used it myself plenty. Very not ashamed of that in any way, and I've helped other people do the same. And I've seen a lot of growth and benefit from it. So, and I also want to talk about how our health system, and especially our mental health system, actually treats trauma, dementia, poverty, schizophrenia, and we really want to look at that without looking away from the reality of that. We're really in for some inconvenient truths, right? To use Al Gore language, and we have to like look at what was needed to repair that via our cultural attitudes and our methods of understanding and treating mental health. And that's going to be messy and nonlinear and eruptive and expensive, and it's got to be really different. And psychedelics is going to ask that of us, and we're, in a as jarring a way as is necessary. If you guys have taken psychedelics, you know that it's not always what you want. It might be what you need, but it's not always what you want or what you're necessarily prepared for. So, if we're looking at this on a systemic level, if we're introducing psychedelics on a systemic level to mental health to people that are suffering with mental health, things are going to get weird. Especially when we don't have systems in place. We have a whole lot of hype about it, and we don't have systems in place to help people actually work through it. There's like 300,000 Google entries for psychedelic therapy in quotation marks. And it's not even legal yet. So we can go to the next slide. Oh yeah, and I want to say also, I read this month there was an article in the New York Times that came out that said that 1 in 9 nursing home residents is being diagnosed with schizophrenia, where it's a condition that affects 1 in 150 because they want to give people Haldol. So the way people are treating mental health actually in this country right now is we're going to get more into that, but again, we're looking at vulnerable populations and how they're treated. That's not to mention people with trauma. That's not to mention people that have emotional dysregulation from trauma, but that are being diagnosed bipolar 2 because they need to give them medicine and they don't actually know what to do with people with trauma. It's too expensive to give everybody EMDR. So, there's a lot more to say about that. But anyway, the promises of psychedelics is that, psychedelics experiences put us in touch with the nonlinear, which is great for this situation, right? Because we need creative outcomes. We need creative ideas for how to work with this. Healing trauma MDMA has been proven to treat acute, severe PTSD, and people are talking about trauma a lot, and it's not actually, it's actually a healing agent. They're repatterning damaged conditioning, healing, you know, and all these. Okay, I misread that. So I keep harping on the same thing, but none of this stuff is simple, and the fact that psychedelics are put us in touch with nonlinear solutions is incredibly revolutionary. It's exciting, and like healing family dynamics, healing corrupt government, correcting climate change. We could really get some ideas and some from psychedelics. And it's also different than other treatments in that it's not symptom management. It's actually a healing agent, because what psychedelics does is it has us face things and see it from different angles. They change perspective, right? And it gets to the root of the issue. It takes us right down to the root. It doesn't let us get away with skimming off the top, right? It asks us to go all the way and actually heal and actually become, the best versions of ourselves and the most alive it asks us to, and it helps us get to the place where we deeply want to be, which is healed, right? And again, when we're looking at this systemically, yeah, what does it look like to live in a healed society? A lot of us are so busy feeling the effects of being in a ill society that we don't even take the time to think about what would it be like to be be healed people in a healed society. And this is kind of what we're going to have to look at if we're going to use psychedelics as healing agents, which we are. Everyone's excited about this, right? So it's we're going to have to stop suppressing things, and that's going to there's a lot more questions than answers that are going to come up, and that's for me as a radical person, and I'm really grateful that this is happening. I wrote in my notes, I've got another screen over here with my notes on it, but I look at this as, it's not a quick fix. It's a portal into a new age, and there's going to be growing pains there. And psychedelics is going to, I think is going to help show us the way, whether we're really prepared for that or not. And I think as nurses and as frontline practitioners, we're going to have a lot to do with that. So we can go to the next slide. Does anyone have any questions so far? Anything like that? How's everybody doing?
We're great. We had some comments in the chat from Mesa that another vulnerable population that's being overtreated with antipsychotics is the foster children system.
Oh, thank
Yeah,
you, Mesa. Thank
heartbreaking.
you, Mesa.
Mhm.
That's so true. That's so true. That's and talk about trauma. There we go. Draw a line right back to trauma. That's so tragic.
Yeah,
I remember
we've had patients though, we definitely saw like quite an upsurge of like suicide attempts in COVID, but even prior, and I mean, in a lot of these kids, and I had one patient in particular who was a foster care teen, and she was on antipsychotics, antidepressants, anti everything. And again, then just kind of being like thrown back in. But when you sat and like talked to her, I just remember like having this connection with her that was like so pure, and I could just see, that she just was suffering. Like she wanted help. Like she wasn't sitting in her, she was ready. Like she was ready for someone to like take her. And it was just like so hard to like have to then transfer her to a psych facility, like an inpatient psych facility when I don't know what the answers are, but I just see that like there has been a common trend that there, like many of these kids in the system are medicated on something.
Oh yeah.
Mhm.
You know, rather
And
than,
this
yeah.
is that's the thing, is that a lot of them, when I was working at a facility where there was multiple units, sometimes I would have to transfer from the adolescent unit to the detox unit. And I'd be like, okay, this is what this is a couple of years. These kids are like 17 or 16, 15, and they're still ready to receive help. Like they still want someone to care. And by the time they're like 25, they're gone. They're gone. They've found their people. They're given up on themselves. And and that was really, it's really tragic, because we as the we don't have, we funnel people in through systems, and we don't have the time in, I'm going to always, I'm like revealing myself so greatly, but I'm just such an anti-capitalist, and like in a capitalist society, people are money or numbers, and it's just not. You're funneling people in through these systems, and we forget that they're people, they're codes, right? They're um and it's that has to change. Like one of those kids, like you were saying, if you had like an hour to talk to her, that could be huge. If somebody could actually take the time to listen and to talk, I mean, that could change people's lives.
Mhm.
We don't, especially nurses, don't have the time to do that. Um, we're so busy,
Mhm.
that we often don't have the time. So, um, yeah. So when we're
Can I just make a comment too, Zoe? It's interesting you said by 25 they've given up on themselves. I wonder if they haven't maybe given up on the rest of us, like given up on society, because as you spoke to,
Mhm.
the avenues that are supposed to be their safety nets, that are supposed to be helping them, we're not always, right? Like as I appreciate that you said nurses feel disempowered, because we do a lot, right? We're a cog in the wheel sometimes, and we feel like there's only so much movement or change we can input. But yeah, I wonder if like you said, by self-medicating, this is how they're not maybe giving up on themselves, that unless, they get to the point where they see suicide as their only exit. But I'm I too am encouraged by this next generation who is bolder and not afraid to question um, a lot of the societal norms that we've been handed down and told this is the way it is. And so I'm encouraged by some of them that are standing up and saying, no, this is not good enough. This is not okay. Let's change it. So
Yeah,
I'm hopeful.
me too. Me too.
Yeah.
I'm also hopeful. I hope this isn't too gloom and doom. I just want to offer another perspective.
Mhm.
And I am really actually positive about it. And
Mhm.
I also appreciate what you said, Sarah, about
Mhm.
that they've given up on society,
Mhm.
and taking that chip on their shoulder. And I see the parallel of like giving up on themselves and giving up on society. And then that's the classic counterculture approach. It's like it's me against the world. And again, with trauma, a lot of childhood trauma, it's like nobody ever cared about me. So
Mhm.
I don't care about myself either. Like that's so common, and nobody ever took the time, so I must not be worth it. Like
Right.
all the things that get stored in there. um that's it takes it I think, and with psychedelics, with MDMA, especially, I feel like there's a lot of repair that can be done with
Mhm.
that in a relatively short amount of time. We don't know how it's going to be rolled out for marginalized populations, monetarily. We'll see. That remains to be seen.
I appreciate the point that you made, that it's actually a treatment as opposed to symptom management. And that's what can make it kind of a game changer from other meds that we're used to using.
Oh yeah, it's so beautiful. It's miraculous. actually, to be a part of. And and I and people want to heal, like if they have, that's, and I think that's, I don't know if I'm talk about this later, but we're talking about it now, whatever. So the that people desperately want to heal. When there's people who are so excited about psychedelics, people that are suffering, they're so excited about something that might actually work. Like they're not going to, and this is again what I'm going to be talking about, that they're not necessarily going to wait for the system that's failed them to to be ready for them, like to have it be sanctioned in the way that they're like, something's going to help me, what is it, I want it, like I need it, I've had enough of this. People really want to heal. They're willing to do something about it, especially the more uncomfortable they are and the more disillusioned they are. So um yeah where let's see, um I think I just kind of addressed that in this slide. So yeah, um so this is the status quo in our health system. Is if you can't code for it, you can't bill it, and if you can't bill it, you can't treat it, right? So basically, the people who write the code books are the people that define human experience, right? And then everybody else that works under that works in that system, is running around trying to fit people into these boxes you can code for, because you can only treat something if you can code for it, because that's the only way you're going to get paid, right? So this is how you have dementia patients being called schizophrenic so they can justify a Haldol medication because they're overstaffed and they need to sedate people, right? This is how you can, you know, call it, a kid that's active, very active. You could say they're oppositional defiant, so that you could give them Risperdal, or you could call them ADHD, so you can give them amphetamines. But whatever, we're treating people because we don't have the time, or the patience or the care to actually sit with them and listen to them and talk to them, right? Um, so so this is something I'm personally a bit worried about, and I've seen actually. But it goes along with the idea that people are going to do this, whether they have, um, whether somebody's going to sit with them or not, whether someone's going to talk to them about their trauma, or and take the time to have them talk about intentions and sit with them and then help them work it out. If they're going to go through a process, like all the studies that are coming out with positive outcomes, people are there to walk them through the process and to be with them and to hold a container that's really soft and loving and safe, and when a really deeply wounded person, like someone who's been, through the foster care system or has been addicted to drugs, when they have an unguided psychedelic experience, which they're going to do, right? Because we don't have systems in place to make this widely available, right? It can have outcomes that are more confusing, and can be exacerbate their condition, and can have them, um, and the medical system then, when they go for help and they're talking about, I think the previous slide, which we don't need to go back, but I think we're talking about how the relevance of that is that people, when they take psychedelics, they start to see how the systems in place are broken. They start to see connections that can look like paranoia, right? That could look like delusional behavior. That can look like, what we'll code for as psychosis, right? And then they're in the system again for something else. They're being treated with something else. So they're trying to help themselves, and they end up um, with what can only be coded for as psychosis, right? Which I really think that this was in preparing for this, this was kind of a flash for me. And like in secular, okay, so in secular society, we treat mystical experience, right, as psychosis. And that's the prime in the psilocybin studies. A mystical experience is the prime indicator that it's going to work long term. So let's think about this, right? We have a problem here, right? Our medical system looks at healing as psychosis. We this isn't going to work. Like something needs to change, right? And I'm concerned about people that are taking this into their own hands, that are just going to get funneled into this system called psychotic, put in a mental, in a mental health facility, and given antipsychotics. And of course they're going to be angry. Of course they're going to be, they're going to be talking about about how the system is broken. They're going to be paranoid. They're going to be like, you guys are agents for the Nazis or something like that. And they're going to be like, oh, you're psychotic. Okay, but here's a B-52. And it's like, I also think I'm also thinking a lot about how, in psychedelic experiences, people see beings. They communicate with beings, and it's a common experience. And in psych hospitals, when people talk about communicating with aliens, they're just like irrational thought patterns. That's all documented as evidence of being psychotic. And I think that's just something that we want to be aware of.
Can I speak to this for a second, Zoe?
Of
Because I
course,
feel
yeah.
really strongly about this as being part of a greater agenda to separate humans from their connection with spirit and with earth, because we're demonizing everything that is in indigenous cultures, appreciated, lauded, even sought after for people who can have visions, who can see, and we've like dehumanized that aspect of our spirit and our consciousness. And I think that's going to be one of the biggest hurdles, is for people to be able to allow those experiences, but then know how to navigate through them so that, they can tap into that frequency, but yet are going to have to function in this reality. And I think that's most of what mental health is. People who are considered schizophrenic or psychotic or this and that, it's like they're spending so much time in that spiritual realm and that space, and there's no container for them to be integrated in society as like, okay, your role as a seer, you can be there and you channel for other people what their problems are. And then, like there's epilepsy, for example, the Hmong community in California, in Merced, California, there's a book about it, The Spirit Catches Me and You Fall Down, where the Western docs were demonizing epilepsy, and these parents were not treating the children for epilepsy, and they were being taken away by CPS and other governmental authorities saying that you're doing the wrong thing. So they'd be forced into basically dumbing these kids down with medications and completely changing their physiologies. Whereas in their culture, the epileptic events were considered one of these connections with spirit, and that those were the actual divine, shamanic healers of the community, were the ones who had those epileptic or, those fits. So it just seems like, there's a deeper colonization happening here with just how people can perceive out of ordinary experiences. And I think that's going to be something that we're going to be up against reversing.
Yeah, thanks for that, Mesa. Thanks for that. I really agree with you there. And as you're talking, I'm thinking about our society as violently secular, and where everything spiritual has been cut out and demonized, like you said, and there's no space made for it at all. And I think a lot about people that write books, chant like Course in Miracles or something, and they're like channeled experiences or psychics and things like that, that they somebody's taught them how to deal with this experience, where people that are schizophrenic, for example, have been told that they have a condition that is, they've been disempowered to just think that there's something wrong with them and it's never going to go away and they have to be medicated and they're the scourge of society.
It's
And
a shameful thing. Yeah.
yeah, and actually there was a TED talk by a woman who had lived through that experience and said that initially when it first started happening to her, she was she wasn't having negative like hallucinations. It was just hearing things, hearing her movements narrated, and she was just like hearing voices and spirit guides that were talking to her. And then once she got a diagnosis and she started to become very small and like shameful about her experience, that's when the voices started to be really like violent towards her, you know. That I think that, you know, and with psychedelics, more people are going to be having these experiences. Like we said, the mystical experience is the prime indicator of treatment. So we have to again get comfortable as a society with the spiritual, like you were saying, Mesa. And I mean, people are trying to figure out how to do that, I think, and it's just, you know, the medical system where we're treating people that are the mental health system is just so far away from being able to handle that. So we're gonna see what we're gonna be part of figuring that out. And the words healing crisis, I think is something that we could start using, as opposed to like drug induced psychosis, or I think like healing crisis, or even spiritual crisis, if we want to go that route, for when people have especially cumulative psychedelic experiences where they're using that. Sometimes if people are taking ayahuasca like every 2 weeks for 6 months, it can get to be a little much, and they can start to lose touch with reality and stop sleeping and start having manic like behaviors. And I think the word healing crisis might be an interesting code, right, that we could start to be looking at, and treat in a different way. If we're going to stick with the system of coding and I don't even know about billing, but and treatment, looking at healing crisis, we could have a different set of protocols, because I'm not going to say that psychosis isn't real, and that it's not destructive or scary for people, and that sometimes antipsychotics aren't indicated. Like I'm not saying that at all, but I'm saying that it's very different than a healing crisis, and the nuances we'd do well to educate ourselves about. Yeah, so this going into this, now we're going to move into psychedelics and integration. So psychedelics, the overview of them they're substances that change your perception in an acute way, right? There's a definition that they are a class of psychoactive substances that produce changes in perception, mood, and cognitive processes. So like, for example, psilocybin, LSD, MDMA, mescaline, ketamine, ayahuasca, iboga, and also cannabis can have psychedelic effects. And I think that's important for us to realize, because of its pervasive use, and specifically for trauma. And people definitely self-medicate with cannabis sometimes, and cumulatively it can have psychedelic effects as well. I've definitely seen and witnessed that, as well as chronic use of methamphetamines and synthetic cannabis can actually cause drug-induced psychosis as well. I've seen plenty of that. So these compounds have been used for decades to centuries, to antiquity across the globe for induction of spiritual experience and healing within a context that our culture doesn't have right now. And in some cases is trying to create, like we're doing right now. We could go to the next one. I'm going to try to speed it up, but not lose too much content. So what makes a safe psychedelic experience, right? I've been talking about what the potential problems for unsafe psychedelic experiences. What makes a safe psychedelic experience? What are the components, right? Some of them are set and setting. That's pretty common knowledge. So who you're with, where you are, if the safety of how you feel with those components, environments conducive to growth. Maybe not, maybe not at a club, or maybe not with strangers or people that, don't have your best interest at heart. And maybe that could, be healing as well. But it's best if you're going to intentionally have a therapeutic psychedelic experience. Those are important things to consider. The substances themselves, the purity of the substance. Drug testing kits are widely available. There's a lot of substances, especially white powders, being cut with fentanyl right now. So when you're doing anything with white powders, ketamine included, or and I'm talking about an MDMA, drug testing is extra important, especially right now because fentanyl is deadly. So drug testing is key. Dosage is a really big deal, making sure you have a therapeutic dosage, not one that's going to be harmful to you physically or mentally, so something you're prepared for. And frequency of use, right? It's different to do a therapeutic ketamine session versus doing ketamine 5 times a day for a month, right? Very different outcomes. So, or taking, LSD every day for a month is different than taking LSD once and having a therapeutic experience. So also important to be aware of is your physiology, your health. If you have heart conditions, or the liver function is compromised, it might, the metabolism of these substances may be something to consider. Any comorbid conditions and medication interactions, which can be something to look into specifically for any MAOIs, like ayahuasca. That's really important to consider. Also, if you have a guide or a group, a lot of people do this work in groups, or a sitter, how much trust you have in them, why you're putting the trust in them, really knowing. If people are desperate, they might just go with whoever, and just or flying solo, or having or like having a sitter that can hold space for you, and really preparing that. Again, this is all about preparation, and then integration on the other side. And I guess the reason why I'm sharing this with you is that, if you come across people, or you yourself are interested in doing this type of healing and it's not widely available, these are good things to, if somebody comes to you and they say, I'm thinking about doing a psychedelic experience, I really need help, and I've heard it could be really helpful. Some things you can ask them to consider if you're comfortable. Like, where are you getting this? Who are you doing this with? How do you know to trust them? Have they asked you about your medication interactions? Like, what is like, it's good to help people think this process through, because maybe they're not available. They're just thinking about, I want to get better, and they're not thinking about the what they need to be considering for it to be a therapeutic experience, which it can be re-traumatizing if it's not done, I'm going to say well, but safely, and carefully. So we can go on. I think I just mentioned this. Yeah. So this is what we can do, right? Is before we might meet people at different stages of this experience, right? We might meet people before they do it. I just mentioned this, when they're thinking about it. Also good to mention that it's illegal where applicable, right? And to be careful with their sourcing. We don't want more people ending up incarcerated for this. And having any resources is nice if you want to go that extra mile. There's a lot of support groups and integration groups online. And there's resources to check for drug interactions. There's resources for people to get drug testing kits. There's a lot available. It's pretty, Google does a great job. I can also offer a few if needed. So this is part of harm reduction, right? When we're helping people think about this and set up their experience. And like I put in here, if you shut them down, they'll shut you out. They're going to do it anyway. So like helping them do it safely is harm reduction. Asking about their intentions. I also like to use the word purpose. Intention can get a little bit like ungrounded or not very, it's not, maybe the word intention seems too fluffy, but the purpose, like, why are you doing this? You know, what are you actually, what's your purpose in doing this? What are you looking for? What do you want out of it? It can be helpful to talk about. Again, all those things I just mentioned, I won't go back into them. Really important to assess whether the person, if they do have a guide, whether their guide has asked them about their medications and their health history is a great way to assess if they're actually going to be prepared. Because you know, if a guide has the best intentions but doesn't understand that drug interactions are possible, then that could be really harmful, obviously. So and using loving and non-judgmental language, of course, is, you know, you shouldn't be doing this, what are you thinking? That's, you know, it's more like being open and encouraging and inviting and receptive. And again, this is a positive thing. They're taking responsibility for their own healing, and taking it empowerment and taking it into their own hands. So I think that's a great thing. We can go to the next one. During the experience, you might encounter someone during a psychedelic experience. There's a great Zendo before doing peer support, and that's primarily it's set up at a festival or a party where people are going to be taking illicit substances and helping turn a challenging experience into a positive experience or a healing experience. When so a lot of psychedelic experiences are challenging, and sometimes people take them recreationally and they don't. But it does open up a whole cascade of like the parts of them that really need deep healing come out. They hear the invite and they come out, and maybe that's not what you had in mind for your evening, but there it is. And so you might encounter people at this stage, and like any vulnerable state, this can be a time for healing, or it can be utterly re-traumatizing. So you might find somebody in this state, and Zendo does really good trainings. I think they're doing online trainings right now, but I would encourage people to look into that. And you can go to the next slide. I put the principles of psychedelic harm reduction from Zendo. This is directly from Zendo. Creating a safe space, sitting and not guiding, not thinking you know the answer to what this person needs, but just being a calm meditative presence that's like holding the space. Like I always think of like a mother, you know, hen sitting on an egg, just being like, I'm holding this down, I've got you, nothing bad's going to happen to you over my dead body type of, you know, just the energy that you're holding. You're sitting with them, you're not trying to fix them. You're having trust that what's happening is what needs to happen. Talking them through the experience, not down. You're not trying to get anywhere, because you know that this experience isn't going to last forever. And if it does, you're not going to have to be holding space forever. You're going to have to pass it off. So without distracting from the experience, because the experience is good. Like it's something that needs to happen, right? You help the person connect with what they're feeling, and you make sure that they know, again, that you're there, and that invite them to take the opportunity with curious questioning. Like, if they say they're scared, or like, okay, what do you notice about that fear? You're actually safe right now, but there's fear coming up. I hear that, there, and some of this is therapeutic tools, but again, Zendo is really empowering in that, like, there's ways that everybody can do this. And I really encourage anybody who's interested to go through their training. And difficult's not the same as bad. Again, like, people, challenging experiences, like a psychedelic experience that is healing, is challenging oftentimes, especially when people are dealing with anything that's difficult. It's the people have been suppressing, people use drugs and alcohol to suppress things that are difficult. Psychedelics takes the opposite approach and brings up things that are difficult so you can move through them, so they don't affect you on an everyday basis. So helping people to move through challenging experiences, but not label them as bad. It's not a bad trip, right? It's a healing opportunity.
And just to say, it's not, it's just that in my experience, I found that, like, they leave it up to the person to say that they're on a medication that needs counseling, when a lot of people, I don't think, even know that the medications they're on could cause an issue, or that they really should be off of all medications for ayahuasca. And then in terms of the tapering, I've just seen some bad advice being thrown around, and I have never seen in these communities, like the two or three that I've sat with, just not seeing any actual, like, physician or nurse or someone with a medical background to understand these pharmacologics agents to be the ones doing the counseling. It's usually like the person leading the experience who has a conflict of interest, if you think about it, because they want another person to enroll because they believe that this is going to be doing good work for them. But so I think hopefully in the future we're going to start seeing more collaborations where there's a physician that maybe even is, like, contracted to do the counseling aspect of the medical tapering and stuff for these groups. In the research environment that Zoe and I are in, it's very different because there's very specific rules and regulations, and there's an ongoing conversation about, even if you take an over-the-counter medication, we need to know in advance. I just don't think that kind of, like, urgency or sense of importance is being as emphasized as people like us probably think it ought to be, just for the purpose of safety, because bad publicity and lack of safety is kind of like what killed psychedelics in the first place. So we have to really just be extra cautious.
I still think too that there is an overarching belief that if it's natural, it's safe. And I think those of us who know better, but I think in the general population, that's still a tenet that a lot of people hold on to.
Yeah. I also know that that's especially true in ayahuasca groups, and a lot of people that are looking for MDMA or psilocybin therapy too are going to underground therapists, and they have various levels of medical training as well, and may not be looking at those medication interactions very well either. And Mesa, to your point, I mean, this could kill the movement, like in that space where there's a lot of hype about it and it's not yet legal. Like, there's not a lot of regulation, and that there's it's a little, but there's not. We really want to get here. We really want to get to where that can be done safely and for people. So we could go to the next slide if we're ready. These are just some personal things that I always think about when I encounter people that are, especially as nurses, if you see somebody that, or in a medical facility or on the street, or when you see someone that's freaking out, right? You know, other things to keep in mind is just always to reduce stimulus. Even if people are having panic attacks, if it has nothing to do with substances, right? Reduce, and you don't know if it does or not, like reduce the stimuli, like turn down the lights, take them out of the commotion, like reduce the sounds as much as you can, like take somebody, if it's at a party or something and someone's really overwhelmed, like be like, hey, come over here. We're going to go to this corner, you know, reinforce their safety and comfort. Don't stand over them, like get on their level to where you can see them, make eye contact, speak softly and calmly and kind of and slowly, and kind of the vibe is like, I have this under control. You're going to be okay. I'm here. I'm not going to leave you. You know, if I do, I'm going to make sure you're okay and pass you off. Like that's the feeling you want to encourage. It's like it's kind of this flowing feeling, right? And make eye contact if, you know, some that we talk about if that's culturally appropriate, but in this situation, people want to, like, I'm here with you, right? They want, like, I'm connected with you. I'm feeling like I understand that you're going through something and I'm here, right? Explain to, this is more in a medical sense, but explain to them what you're going to do before you do it. This is trauma informed care, right? Don't touch people without asking them, or in some cases telling them first. I think of EMTs in this, you know. Don't just strap them down, you know. Don't just insert an IV. Like, it's important to tell people what they're doing and make sure, again, you're looking at them, you're like, okay, I'm going to do this now, but you're safe. This is for your safety. You're going to be okay. You know, you say as many times as you can that they're going to be okay and that no one's going to hurt them and that they're safe. Asking yes or no questions. Don't ask complex questions. I think this is pretty much for anyone with a panic attack or that's overwhelmed. But this applies in this situation as well. Okay, we can go to the next one. Trying to be quick. And then okay, so you might encounter somebody after an experience. And this is the integration time. It's maybe the most important time when people are trying to make sense of their experience. And this can be, again, I'm cumulative as well as acute. So this could be a result of a healing crisis, right? Where somebody has been doing these treatments for a long time unguided, and all of a sudden their sense of identity is kind of lost, and they don't know who they are. They don't quite understand what's going on in the world. You know, it's when people use a lot of psychedelics over a short period of time without any integration, this can happen. And again, we're using the word healing crisis. So yeah, this is, so this is funny. This is a little funny for me. I think it's funny. It's my sense of humor, but I liken this to, you know, especially when people are traumatized and have a weak sense of identity already, and maybe don't have used dissociation a lot as a coping skill, and don't have necessarily a firm grip on reality already. It's really easy for this to happen, right? Which are the people that are going to be really going to want healing. So it's kind of like with psychedelics, you could take it's like taking a Tupperware out of your fridge that's been in there for 20 years, right? And when you first put it in there, it was a betrayal by a caregiver at 5 years old. And you take it out 20 years later, and it's like a putrid, furry monster, you know? And you're like, what the fuck is that? Excuse my language, you know? I'm like, this is a monster and it's living inside of me. And this must mean that I'm horrible the way I always thought I was horrible. And, you know, this is so disgusting. I can't believe this is living inside me. I must be the demon that my mother said I was. You know, people can get really confused, right? When they don't, without the proper guidance and support for somebody to be like, oh no, you know, what does that remind you of? What are the feelings that come up for you around that? Like, people are putting, without any kind of integration care, people are putting their the information that they're collecting from the psychedelic experience into their already disturbed narrative, potentially, you know, and without any kind of help with that, people's tricky tricks can be reinforced, and they can get more confused. I'm such a big, I mean, I'm a proponent for like really solid loving care in these processes, which I'm just worried people aren't going to get. And I think that as nurses, as in people that might be coming in contact with people at this level of like, this is where the people that you're going to might be seeing are at. It's important to keep that in mind, and like be like, oh, you know, I don't, you know, just help them question that belief, or you know, help them ground into, you know, how that might not be what they think it is, or there's meeting people where they're at again, but understanding that this could be where people are at. Does that make sense? I'm seeing some nods. Okay, so I think we can go to the next one. Psychedelic integration, what is it, right? What is it? What are some of the things we're trying to put together when we think about psychedelic integration of an experience, right? Which is a lot of subconscious material. I hope we all understand at this point what a psychedelic experience kind of is, right? So meaning making, right? This is when we're taking the subconscious material and trying to understand what it means. What does it have to do with my life? How does it change things? How does this new insight change things in my life? How does it add texture? How does the information fit into the whole picture? What are the feelings, emotions, visions, conclusions that you've reached? Like sometimes with psychedelic integration, I like to really start with, what did you feel? What did you see? Like, without making meaning at all, like, what are the things that came up? What are the themes, right? And you know, what's being asked of you regarding your own healing? Like, how are you being asked to stick up for yourself, or to stand up for yourself? Like, how are you being asked to move forward? And how can you do that lovingly, right? So it's also about next steps. As practitioners, it's like, what can we do to keep an open mind and to listen without making assumptions of our own? Again, here we go with the mystical experience and psychotic episode. These can look similar again when people are really wounded, right? Because they might look psychotic, right? But they might have had a mystical experience that was very scary and that is very confused with their pathology. So, you know, really, I'm really a proponent for guided work with people that are not quote unquote healthy normals, right? Which is what they call people in research that don't have any kind of mental health background. So what's the difference between having a direct, I mentioned that earlier. So we have to get comfortable with not knowing if we want to be a part of this, right? And the not knowing is like, I don't know, what do you think? You know, just sitting, not trying to like fix it right away, but sitting with someone in their not knowing is really powerful.
Zoe Maya shared that reinforcing that you are not your thoughts and emotions.
That can be, perfect. And helping people to understand that.
Yeah, I think that's a big difference too between the training that like psych nurses get versus more like physiological nurses get. I would love for there to be more of that training in our training, because clearly there's an epidemic of mental health crises. I think anyone who's in our environment, Diana and my environment is the PICU, anyone who's in the ICU is going through some kind of crisis. Nobody is in the ICU and totally chill and happy with that, right? And so I would really love to see a day where, as the bedside nurse who is beside that patient for hours at a time, we were more equipped to have these techniques in our toolbox too.
Yeah, yeah. I mean, and it's really, I'm going to say it's really like psych nurses don't necessarily, they're heavy on the meds too. I think this is coming for like, I'm, I think it really can be like you could empower yourself with this kind of, it's an ethic and it's a way of being, that you can adopt just by being it. And, just by, and that's kind of what I'm encouraging. I think it's a powerful way to be, in general, and as nurses, like you were saying, Diana, how powerful it is to sit with somebody in the not knowing can be paradoxically the healing moment, that they never had before, and that they're going to have in this experience that's unexpected, and it's really touching. It's like movie material. It's really quite beautiful to have that kind of connection of like, you don't know, I don't know either, but we're here together. So we could go to the next slide if you want. I'm really trying to be quick and also get through everything. So this is, I think we're kind of wrapping up here. This is, I think, the final section. And I'm assuming that people that are interested in this are also interested for personal reasons, right? Caregivers also need care. Where a lot of us are wounded healers, and that's important, right? That increases our capacity for empathy. And so asking for a friend, or you might be dealing with family members who are doing this, or you might want to help your friends, or, it's kind of like all the things we talked about are applicable, right? And then I just tried to put a couple more ideas that might be helpful in that instance, right? So this is especially for integration. So don't make assumptions. Don't, especially right away. Try curious questioning is like the end all be all of psychedelic integration, where you don't know, but you're curious, like coming from a place of actual curiosity. Sometimes it's tempting to be like, I know, but you don't know, so I'm going to help you with these guided questions until you reach the conclusion I have. But it's really more helpful to really just be curious and be like, I don't know, purple. You said a lot of your experience, you had purple clouds. What does that bring up for you? Like, what do you think about the color purple? Just wherever you can be curious, kind of getting more information, extrapolating the information, especially directly post experience, not putting meaning together right away, pull out more information. Be really kind. I think that kind of goes without saying, but it's a magic. Kindness is a type of magic that we forget about a lot. And this is important. Talk it out with somebody else, and ask them. And you can, even if this is for you, talking it out with someone else and just asking them to just ask you questions, like guiding them to guide you. Sometimes that's what you got. That's what you got to do, and it being like, just ask me questions about my experience. Don't tell me about it. Like, don't make assertions. Be like, oh, that must be about your mother, she's, or anything like that. Just being like, oh yeah, what do you think that's about? Like having somebody do that for you, or telling people or yourself to take a voice recording, kind of like a dream, like you're recording a dream and you're just saying it, and then you can listen to it later when you're back in your own ego structure, and you want to listen to it, and then you can start to draw the lines between those things. Again, I'm emphasizing, don't draw conclusions too fast. Like, let it be for a while, and know that it takes a couple days, a couple weeks, like it takes a while for integration to happen, and like staying kind of open for as long as it feels safe. I always tell people, don't go right back to work the next day. Like, this is not, don't stress yourself out like that. Like, help your future self by making the time for you to be vulnerable for a while and open without having to close back up and put on your suit of armor again. It's really, that really helps facilitate the integration process to because you do really open up and you're really vulnerable afterwards, and you don't want it to be jarring. That can be sub-therapeutic. You can go to the next slide. Yeah, we're looking for patterns. Patterns is in our everyday behavior and in the psychedelic experience, like themes, patterns. It's a discovery process more than anything. Somatic experience. What do you feel in your body? What feels true about that? Psychedelics can be a really good indicator of truth. And what feels true, does that feel true? Things that, and then people sometimes can be like, oh no, that doesn't feel true. And then you just dismantled a whole entire belief structure that you've been living with for years. Actually, that's not true. Wow. That can just be a really important moment. Open-ended questions. Eventually, these are more, now we're going more into post, like after the acute phase, how to keep it going, right? Rewriting narratives. Storytelling can be really powerful. Retelling stories, journaling, listening to the same music you were listening to during the experience can be really helpful to take you back there. Any kind of art and symbology, mantras are helpful. Anything. Sometimes in psychedelic experiences, something will come up and you'll realize something and be like, I'm worthy of love. And that can be like an experience that can just blow your heart open. And remembering those kind of triggers to those feelings can be really important. And like anything like that crystallizes the experience, it could be like a field of sunflowers, that was really strong for you and elicited a certain response that was healing. You can recall that field of sunflowers, and it can help you remember the lessons you need to out of that experience.
Zoe, if I can just share, I was listening to a podcast where the singer Casey Musgraves was sharing about her psychedelic experiences. And one of the things that she spoke about was that in her experience, she listened to a curated playlist, if you will, of music that spanned many genres, but was curated for this experience. And so some of the music might have been more sad, some might have been more up-tempo, more angry, just to really allow for a lot of different feelings to come up. But what I found really interesting, because from what I've gathered from the information we've got so far, that it is coming out of it can be like a dream, like you said, recalling a dream and recalling parts of it. But what she said is that she can now go back and listen to that playlist now and recall with great clarity what she was feeling and thinking at the time of the initial experience, which I thought was pretty amazing, right? And she can tap into that and reprocess it or use it creatively in her songwriting and stuff. I thought that was really neat. I didn't realize that it would have such powerful recall ability after the fact.
Oh yeah, music is memory, right? Music is memory. I that's really incredible, and I think it's a really good way for people to continue working with the experience. And thanks for bringing that up. I think a lot of in the studies we do use curated playlists, and it's really helpful to give to clients to help them, while they're falling asleep, especially, or, anytime they have the time to recall that. And for certain people, they're more attuned musically, like this artist, is a musician. So that speaks really, really strongly to them. And other people might be more visual, where, art and symbols might be, and visualizations might be more powerful, and it's a toolbox, and I think the playlists can be really helpful. That's how a lot of in the studies we use playlists that are evocative, that elicit emotional response.
I'm curious, because I've heard that smell is one of the most strong senses strongly associated with memories. So I'm wondering, has that ever been used too, having certain like smells or fragrances that again can be smelled later to recall
I
that?
think that's a great idea. I mean, I don't think they use it clinically in trials, because again, in drug trials, consistency is important. If you introduce new variables, then we don't know if it's the lavender scent or the MDMA that's helping with the PTSD. So, but I think on the DIY spot, I think that might be really helpful. I know that in PTSD treatment, we use scents a lot to help people ground when they're dissociated, and like lavender, orange, or any, we use a lot of essential oils, or sage. I know in ayahuasca circles, people use a lot of sage or Palo Santo, or different smells that then again bring people back to that experience. So I think that could really be useful. I think we can go to the next one. We're like way over time. Ongoing integration is important. I think it needs to not be in a bubble. We got to kind of take the shame around it, and it's great. I want to put a caveat on that. Some people are really excited about it, so they tell a lot of people in the beginning that they're going to do it, and then in the end they're like, oh, this is a really vulnerable thing. I don't necessarily want to share all this. So like finding the balance about like who you feel safe to talk to about it versus who you don't, and making sure that you are honoring yourself, because when you're vulnerable, you don't want to open yourself up to criticism and or anybody being like, well, that sounds stupid, or that sounds wrong, or anything. You're like, no, this is a place, especially where you're accepting your own authority, and that's really edgy for many of us. So I think that's important. And culturally, I think we need to be ready and open. And if somebody's like, I had a psychedelic experience that I'm really confused about, just being like, tell me about that. Again, open-ended questions. Just tell me about that. Don't assume I would love to see this rolled out as a cultural norm. So like, here's hoping. But and again, like as nurses, I definitely do this sometimes. It's really important to put boundaries on, because we're caretakers, and we're like, we could listen to somebody's trip report for like an hour and a half, as long as they're willing to go on about it. And like, that's not caring for ourselves. So if you're like, I have 20 minutes to listen if you want to talk, and I'll be really present with you, and I won't be off on some other tangent thinking about all the shit I'm not getting done because I'm listening to you. It was like being really realistic about what we're able to give. It's really, it's something I've had to learn. That's how I know that. And the power, you might think that people don't notice when you're distracted, but they do. The difference between being present for 20 minutes or just being annoyed because you're still standing there for 45 is palpable, even though the person's just going on and on and on. So if you really wanted, it works both ways. It's better both ways to do that. And again, this is all of this like is changing culture. I thought of a tagline the other day where I'm like, I want to be at the intersection of science and softness. And like, that's, I feel like is a place of radicalness, and where we're not telling people about themselves. We're not pathologizing people. We're just like, we're not providing answers. We're just providing space. And for ourselves too. Like, this isn't just for them. This is also for us. And that's why I did this last piece. Yeah, we're not the authority on anyone's experience. And, again, when we're not even the authority on our own experience, because we have to leave space for us not to know. Because we are also untapped sources of wonder, and we're like been so conditioned to think of ourselves in a certain way, and psychedelics asks us to think bigger. And so we really, you know, we don't want to do this alone, and we can't do this alone. Next slide. I just keep saying the same things. So yeah, this is a nonlinear process. Psychedelics are nonlinear medicines, which makes them the perfect healing partners. And I think I said this in the beginning, but we just got to know that it's going to get weird. Psychedelics are weird. And and introducing them into culture is going to get weird, you know, and that's, I think, is the best thing that could happen. Especially when we're healing. And we've developed really clever ways to trick ourselves into never being hurt again the way we've been hurt. And we've been conditioned to think this is right and this is wrong. And any parts of you that fall in the wrong category are you know, suppressed. And so, you know, that all of this is going to come up, and we have to really, and it's our challenge to embrace it. So there's a lot to untangle. And yeah, I'll share a personal story from a journey I had where I found myself sitting in a room. It was like some kind of old school round, like Rumpelstiltskin like place. And there was like messes of tangled yarn all over the place, all different colors. The whole room was taken up by tangled bits of yarn. And I was just like, how am I ever going to do this? Like, my job is to untangle this yarn, and like, I don't know how to do this. This is going to take me my whole life. Like, I'm so stressed out about this. You know, the anxiety was the main feeling, right? About having so much confusion to figure out what to do with. And then I realized that the healing moment in that was to realize that I had a choice in how I responded to that yarn. I could sing while I was untangling. I could, you know, be in my own rhythm. I could be in my own self and be, you know, whistling while I worked and humming while I'm untangling this medicine. And it didn't have to be stressful. Yes, there's a lot of work to do, but I have a choice in how I go about doing it. And I think that applies in this situation. We can go to the next slide. Final thoughts. I think this is the last one. So thanks for bearing with me. There's no magic bullets. None of these are tools. I mean, none of these tools, these are tools. None of them are solutions in and of themselves. They are tools, and really radical, powerful tools, really, really powerful tools. And they have to be integrated into a framework for healing that's not linear and that is very kind, patient, and forgiving, and asks more questions than gives answers, at least initially. I'm here for it. And there's just a lot of questions right now as psychedelics become mainstream. And thanks for being a part of this. Thanks for listening. Thanks for being excited about it. And yeah.